everyone, my name is Lawrence Ann P. Somera. I am a nursing student at Universidad de Manila, and today I will demonstrate Gordon's Functional Health Assessment. Gordon's Functional Health Assessment provides a holistic health assessment or model for assessment of the family. Because assessment data are classified under 11 headings, it also provides subjective data that may indicate future decline or improvement in health status, allowing the nurse to plan an interview appropriately before we start assessing the patient. We must first check his or her chart. Medical charts contain medical relevant events that have happened to a person. A good medical chart will point a clear. Next is to wash hands and observe appropriate infection control procedure. Nursing washing their hands will only prevent from getting sick, but it also reduces the risk of infecting others if they don't wash their hands properly before coming into contact with others. They can infect their patient but also their family members. Good day, I am Lawrence Ann Somera and I am a nurse student from Universidad de Manila, and I will be completing your appointment for today, so I'll just be asking you a few questions about why you're here and a little about your background or history. So if you feel a little uncomfortable answering a question, just let me know, okay?
Okay.
So before we move on, can you please tell me your name and the date of your birth?
My name is Hilary Claire Esquivara and my date birth is November 2, 2010.
Okay, so we're just doing this to ensure that I am with the right patient, and also you don't have to worry about the information we're going to share with because it will remain confidential unless any healthcare personnel would want to access information for your record. Okay, so for the question for the health status, so this is for your health perception. So this is for your health perception and health management is to enable a more thorough report that clarifies about your condition. Okay, so the first question is, how would you describe your usual health status?
I'm okay, but I'm suffering from toothache.
Okay, you're healthy. Okay, you're healthy. Okay, so are you satisfied with your usual health status?
I'm okay.
Okay, so do you take any immunization like vaccine?
Yes.
Okay, what it is? Pfizer. Okay, so do you have any healthcare assistant in the past year?
None.
Okay, that's good. Do you have any history of chronic illness?
None.
Okay, so are you taking any medication?
No.
Okay. How about your living condition at home? Is it fine?
Yes.
So, do you use tobacco?
None.
Okay. How about alcohol?
None.
Any recreational drugs?
None.
Okay, that's good. Okay, so do you had any breast set examination?
None.
Okay, when was your last dental, medical, and physical checkup?
I think last year po.
Okay, good. So, do you have exercise in a regular basis?
Yes.
Okay, so what type and how frequent?
Once or twice a week, like jogging.
Okay, that's good. So, have you had any accidents or injuries or falls?
Yes.
Okay, so have you had any problems during the healing process if you have cuts?
None.
Okay, next step is for your activity and exercise pattern. This can improve your health and reduce the risk of having several diseases. Okay, so do you have any eating problems?
None.
Okay, so do you have cough?
None.
Okay, so how do you perceive your own self-care activities? Do you take good care of yourself?
Yes.
Okay, that's great. Are there any changes in your heartbeat during exercises?
Yes.
So how about, do you feel pain during exercise?
Yes.
What type of exercise do you have?
Sometimes dancing, walking, and jogging.
Okay. So are there any problems?
None.
So, how many pillows do you use to sleep on?
2.
Okay. So, do you experience fatigue weakness?
None.
Do you have occupation?
None.
Okay. So, describe your usually leisure time, activities, or habits. What is your happiest habits?
Singing.
Okay, that's good. So, any problems with concentration?
None.
Metabolics and nutrition. So, this is to define your nutritional status and to define, measure, or real malfunction and to monitor changes in your nutritional status. So, do you have any weight gain or lose gain for the past 6 months?
Yes.
Okay, how many?
I think 1 to 2 kilos I gain weight.
Okay, that's great. How about you describe your appetite?
Malakas kumain.
Okay, that's good. Describe food likes and dislikes.
Vegetable and fruits.
Which one do you like? Vegetable and fruits. Both of them are your like.
Yes.
You like it? Okay. Do you like sweet or salty?
I like sweet.
Okay, that's good. Would you like to gain or to lose weight?
To gain weight.
So, do you have any food tolerance or restrictions?
None.
Okay, describe an average day's food intake for your including your snack.
3 times a day.
Okay, that's good. So, describe an average a day's fluid intake for a day.
8 gas a day.
Okay. So, do you have any problems with nausea, vomiting, swallowing, or chewing?
None.
That's good. So, would you describe your usual lifestyle?
Yes.
Healthy or happy?
Yes, I am healthy and happy.
Okay, that's good. So, for the next set is your elimination pattern. This is to ensure that you have a regular soft bowel movement and advocate urination and to identify different abnormalities. Okay, what is your usual bowel movements?
Twice a week.
How frequently pee?
5 to 6 times I guess.
Okay, so every after meal like that?
Yes.
Okay, so any history of constipation like diarrhea?
None.
So, the character of stool, what is the color of the stool?
Brown.
Okay, brown. That is healthy. Any bleeding?
None.
For your usual voiding pattern, how frequent you void?
Sometimes.
Okay. 2 times a day?
No, once a day.
Okay. Are you full control of your void?
Yes.
Okay, that's good. What is the amount of your void? Normal?
Normal.
Okay. So, the color is brown and no incontinence. Okay. So, for the next set of question is for your sleep pattern. Is a vital and which is often neglected. So, this is a component of every person overall health and well-being. Okay, the question is, so what are your usual sleeping habits?
8 hours.
Okay. That's good. So, do you have any difficulty going to sleep?
None.
So, do you wake up in the middle of the night?
No.
So, do you wake up early?
Yes.
Okay. Do you have insomnia?
None.
Okay. So, do you use any medication or fluid techniques to promote sleep?
No. None.
Okay, that's good. So, for the cognitive perceptor pattern, so this is assessment is focused on the ability to comprehend and use information on the sensory function. Okay, so do you have any hearing difficulties?
None.
Okay, how's your vision, Hillary?
Not normal.
Okay, that's good. Any change in memory lately?
None.
Do you learn things easy?
Yes.
Okay, are there any discomfort like pain?
Yes, I have toothache.
So, toothache. What makes your toothache worse?
Cold.
Eating cold? Okay. Do you do house chores?
Yes.
Okay. What does the toothache feel like? Is it stabbing?
Yes, it is like stabbing.
Okay, so do you feel the toothache being any elsewhere or nothing?
Nothing.
Okay, that's good. How would you rate your toothache from 0 to 10? 0 from no pain and 10 from severe pain.
5.
Okay, when did the toothache started?
2 days ago.
Okay, is it constant?
No.
For your self-perception and self-concept pattern, this is to understand what attitudes or emotion you are experiencing. So, what is your major concern at the current time like this pandemic?
Being healthy.
Okay? So, how would you describe yourself most of the time? They feel good or not?
I feel good.
Okay, that is good. Is there any changes in your body or things you can do?
None.
Okay. There are any changes in the way you feel about yourself or body since you had illness?
None.
Okay, that's good. So, do you believe that you will have any problems dealing with your current situation?
Yes.
Okay. So, what are the things that frequently makes you angry or dislike?
Messy room.
So, do you ever feel like losing hope?
No.
Okay, so on scale of 0 to 5, round your usual assertiveness level.
3.
Okay, that's good. On scale 0 to 5, how would you rank your level of control?
4.
Okay, that's good that you can control your... Okay, so next is all about your role and relationship pattern. So are you single in a relationship or married?
Single.
Okay, so do you live alone or with your families?
With my family.
Okay, that's good. It's nuclear or extended?
Extended.
Okay, so any family problems you difficult handling?
None.
Okay, so do you have any bruises?
None.
Okay, so how do you handle if someone is lost?
Ask the box that he or she is gone.
Okay, do you believe that this admission will result in any type of loss?
Yes.
Okay, so do you think this admission will cause changes in the family role?
Yes.
Okay, so how would you describe your social activities? Do you hang out with your friends like that?
Yes.
Next, for coping and stress tolerance pattern, is there any stressful or traumatic event happened recently?
None.
Is there anyone available to talk to you?
Yes.
Okay, so how would you rate your usual handling of stress? Do you handle your stress well?
Yes.
Okay, that's good. So, do you have counseling group in the past year?
None.
Okay, so when do you have a big problems in your life? How do you handle it?
It by facing firstly bravely.
Okay, most of the time are displaying success
Yes.
for your sexuality or reproductive pattern. So, if you feel uncomfortable answering this question, just let me know, okay?
Yes.
Are there any problems, Hilary?
None.
So, how is your sexual life?
Okay or normal. Normal.
Do you use contraceptives?
I didn't think so. I
Oh.
don't think so.
Okay, so when your last menstruation period?
Last month.
Okay, that's good. So the next is the last pattern, which is your values and beliefs. Okay, so are you satisfied with the way your life has been developed?
Yes.
Okay, that's good. So will this admission interfere with your plans for the future?
No.
Okay, that's good. So what are your plans in the future?
Finishing my studies.
Okay, that's good. So what is your religion?
Catholic.
Okay, so that's these difficulties, all right?
No.
Okay, so are there any religious or extremist restrictions?
None.
Okay, so are there any things we haven't talked about that you would like to mention?
None.
Okay, so do you have any question or clarification?
None.
Okay, so that would be all. Thank you for answering these questions. And I will forward this to the doctor and we'll see how we will proceed to the next assessment. Okay? Thank you. That's all.
Thank you.